In our last video, we touched upon external environmental factors that are toxic to us and may shorten our lifetimes. These included combustion products, ethyl alcohol, prescription drugs, and over-the-counter medicines. We move now to internal poisoning, chemicals that are made in our bodies that cause us discomfort or disease and may diminish the quality or quantity of our lives. The truth is that most of the chronic diseases that shorten our lifetime are caused by chemicals that are made in our own bodies. The list is much longer than we have time to discuss in this video, but this discussion will hopefully help you understand the process and allow you to read well and learn more about your bodies. We'll begin our discussion today with a look at one of the most important hormones, insulin. This small protein is made in the islet cells of our pancreas and is released into our blood whenever we eat a carbohydrate food, causing our blood sugar to rise. When the system is working well, especially when we're lean and active, the rise in blood sugar that follows a carbohydrate meal leads to an increased release of insulin from the pancreas. The insulin goes into small receptors on the wall of the liver and muscle cells and promotes the entry of the sugar in the blood into those areas. The sugar from the carbohydrates then ends up in the cells and gets cooked for lunch inside our liver and our muscle cells. The result is that we have energy to run our interior machinery, and it allows us to live and be active. After the meal, the sugar, which was increased in the blood, returns to a low basal level, and the insulin, which was released into the blood, also returns to normal. This process goes on day after day throughout our lives, and it's absolutely necessary for us to be healthy. Now let's discuss the two basic things that can go wrong with this marvelous process. The first of these occurs when the pancreas gets damaged, usually by a viral illness or overactivity of our immune system, and the islet cells of our pancreas begin to die. The result of this, ultimately, is absence of insulin altogether and very elevated levels of blood sugar. This process is currently called type 1 diabetes, or insulin-deficient diabetes. We'll not discuss this much more in this video, but suffice it to say that the treatment of this situation is injected insulin, which must be supplied a number of times each day or whenever carbohydrates are consumed. The second pathologic process that involves insulin, however, occurs mostly when we begin to store fat, and the fat accumulation involves our liver and our muscle cells. When these cells become engorged with fat, the receptor for insulin becomes damaged, and the insulin, which arrives at the liver and the muscle cells after a carbohydrate meal, no longer fits into the insulin receptor on the cells. This allows the blood sugar to remain elevated for many hours after carbohydrates are consumed, and it tells the pancreatic islet cells to send more insulin. The insulin continues to accumulate outside the liver and muscle cells, but it does not work well, and both the insulin and the sugar remain elevated for hours after the carbohydrate meal. The normal excellent blood level of insulin in a fasting person is in the range of 2 to 5 microunits per ml of blood. But in the insulin-resistant situation, insulin levels may remain at 25 to 30 microunits per ml, 10 times as much. You might say at this point, well, who gives a dang? The answer should be that all of us should care, because insulin, while absolutely necessary for life, is toxic to human cells when its blood level is high. In other words, elevated blood insulin levels poison us and may shorten our lifetimes. It turns out that considerable evidence has accumulated that insulin in high concentrations damages the linings of our arteries and promotes the inflammatory processes that ultimately cause atherosclerosis, or hardening of our arteries. The process in which insulin is present does not work is called type 2 diabetes, or insulin-resistant diabetes, and may result in damage to arteries all over our bodies. Every one of our organs has arteries with intimal linings that may be injured by high insulin levels. This is the reason that patients with type 2 diabetes may develop damage of so many different parts of their bodies, including their hearts, their eyes, their kidneys, their intestines, their skin, and other locations. Although we treat type 2 diabetes with various drugs and sometimes with more insulin, the best therapy during the early stages of the disease involves getting the fat out of our liver and muscle cells, usually with changes in diet, activity, and the bacteria and yeast that grow in the intestines. Hundreds of thousands of individuals with elevated insulin levels and insulin resistance have seen their sugar and insulin levels drop to the normal range with dietary and activity changes alone, no drugs or medicines. I think that all of us would agree that insulin, which is a protein necessary for life, is in this situation a poison, which can shorten our quality and duration of life and health. Another confusing topic that relates to internally generated toxicity is that of cholesterol and other lipids. Cholesterol is a kind of fat molecule that is produced in our liver and is used all over our bodies as a kind of structural nutrient. In other words, cholesterol is a building block for a number of important substances like estrogen, testosterone, cortisone, and aldosterone. Our brain and our peripheral nervous system has cholesterol as a basic building block. And without cholesterol, we would not be able to make any of these hormones or to be able to repair damaged nerve tissue. You may ask at this point, well, why everyone should want to get their blood cholesterol level lower to achieve better health? This is a good question, and the answer is often very confusing for a health-conscious public. It turns out that the disease from which most people in the world will likely die is some variant of what is called atherosclerosis. In this condition, which afflicts millions worldwide, our arteries become damaged by inflammatory processes and form internal scabs that are called atheromas or plaques. These little scabs may be very small and not cause us much difficulty, but they can also become very thick and dense and cause blockage of our large and small arteries. The disease has been much studied over the past 100 years, and the Nobel Prize for understanding of its cause has not yet been won. Suffice it to say at this time that the inflammatory process seems to be related to multiple insults, including smoke exposure, chronic elevation of insulin levels, and chronic low-grade infection, like that which occurs in the mouth of a person with gingivitis. We are discussing this process as a type of poisoning related to cholesterol and other lipids because when we cut open an atheroma or a plaque, it contains a combination of scar tissue, smooth muscle fibers, calcium, and cholesterol, damaged cholesterol. When doctors began to recognize this composition of plaques many years ago, it was natural that they would assume that cholesterol in the blood caused the cholesterol in the plaque or the atheroma. This theory is still held by some, but the truth is that many people who have very high blood cholesterol levels have no plaques or atheromas whatsoever in their arteries, and other people who have relatively low cholesterol levels in their blood have extensive atheroma or plaques. In general, people who have high blood cholesterol levels have more atheroma than those with low cholesterol levels, but the relationship is certainly not linear or pure. Studies done over 30 years ago showed that lowering blood cholesterol levels by several different means led to a slowdown in the development of atheroma or plaques in middle-aged adults. This led to a search for a variety of drugs that could be used to prevent the production of cholesterol in the liver, or to cause cholesterol in the form of chemicals in bile to be lost via our bowels. The important question is whether cholesterol is a kind of metabolic poison, and if it is, at what age should all of us take medicines to decrease its rate of production in the liver? The truth is that we don't know the answer to that question, at least not at this time. We have no explanation as to why some people with a cholesterol of 250 have no evidence of disease, while others with a cholesterol of 175 may have rapidly advancing production of atheroma in their arteries. The truth appears to be that cholesterol is made in the liver when the liver receives signals that more cholesterol is needed in various parts of the body, or to make more estrogen, testosterone, or other hormones. It would appear that when the liver receives those signals, either related to diet or other environmental exposure, it begins to make more cholesterol and to secrete the cholesterol into our blood. In other words, when there's something wrong in our bodies, the liver makes more cholesterol. it seems likely that something wrong is what is really causing the disease of the linings of the arteries, and that some of the cholesterol produced in the liver arrives within white blood cells at the point of inflammation in the lining of an artery. We can take various drugs to decrease the production of cholesterol, and there are a variety of behaviors that we can undertake to lower our blood cholesterol levels. Unfortunately, the drugs only slow down the process, which often slowly progresses to nearly complete blockage of arteries and the heart attacks, strokes, and gangrene that is the end of the process. Is the cholesterol in this case really a poison that shortens our lifetimes? I doubt it for many of the reasons discussed. Should we do behaviors that lower the production of cholesterol in our livers? Oh, I think so. The other things discussed above that make the liver make more cholesterol are likely reversed or discontinued with the behaviors that lower production of cholesterol. So what are the behaviors that result in decreased production of cholesterol in the liver? There are a bunch of them. They include, number 1, loss of body fat, probably loss of fat from the liver. Number 2, avoidance of smoke, especially cigarette smoke with all of its toxins. Number 3, increased physical activity of all kinds. Number 4, decrease in dietary fats, especially trans fats that we'll talk about later. Number 5, increase in dietary fiber, especially water-soluble fibers like oatmeal. Number 6, control of stresses, anything that decreases the need for more cortisol or hydrocortisone. Number 7, avoidance of foods to which we have low-grade or high-grade allergies, poisoning. Number 8, increased intake of various vegetables like garlic and spinach and broccoli, essentially vegetables containing lots of fiber. Number 9, avoidance of medications that cause the liver to make more cholesterol. There may certainly be some benefit in our taking some of the currently available medicines that decrease production of cholesterol in our liver, but that can't be the answer to this question, or the end of the equation. The underlying disease will likely continue to move on relentlessly regardless of our taking the drugs, if we don't understand the causes of the disease. Suffice it to say that all of us should understand what we have reviewed in this video if we hope to be good caretakers of our health. We'll continue to talk about poisons and toxins in our next video. Until then, stay healthy.